We have two special people who are giving us the gift tonight of sharing their stories with us, Marilyn and Hashir. And they're going to tell you their stories, and then after their story, they've kindly agreed to answer your questions, so you can ask them additional questions to find more about their story. And you know, it's just a very powerful experience for me, having these people, these wonderful people giving me, as well as all of us, this gift of their very personal stories. So, Marilyn, would you like to come up?
Good evening, everybody. This isn't as easy as it looks. Let's put this down here. First, I have to thank my husband, my sister, my sister-in-law, my brother-in-law, those three right there, and my good friend Brian for coming, because I didn't think that I would know anybody except for maybe Dr. Rahman might show up. So I'm grateful. Thank you. I have to read this because chemotherapy has dulled my thought process, and I don't want to miss any of the good parts. My name is Marilyn Walsh. I'm 58 years old. I live about an hour southwest of London on a farm near Elvinston. I have two grown sons. Jorn is 30 years old, and he is a social worker living in Toronto. Arlen is 26 years old and lives in Montreal with his wife, Ariel, while he is attending university there. My husband, Bob, is my strength and pulls me through all of this. He is my rock through the toughest times, like when he's driving me to my chemo appointments and I want to say no and jump out of the car, or when I'm swelling up from the steroids and I want to stop taking them, or when he sits quietly beside me for 6 hours at a time during the IV therapy. He shaved my head into a pretty snappy hairstyle. He gives me the needles that I have to keep my hemoglobin levels acceptable. He can lift me up with his smile. I do what I have to do because he does so much for me. I know it is so much harder for him to watch me go through this than it has ever been for anything that I have to do to beat vasculitis. My family probably doesn't realize that they give me strength beyond what any medicine could ever do. In August 2009, I had just finished physiotherapy, recovering from a broken left shoulder, when my right shoulder and neck seized up, and I couldn't move them. I went to the emergency department in Petrolia Hospital. The doctor there thought it might be repetitive work injury, but he decided I should have an x-ray of my shoulder as a precaution. There was no one there that could read the x-ray that night. The next day, I got a call from that ER doctor telling me that it was very important that I go back to the hospital for a chest x-ray. Later, we learned that the shoulder x-ray had shown something questionable in my lungs. I went for the chest x-ray the next day. By then, the stiffness had gone, but I had achy joints, no appetite, and no energy. I went to see my family doctor to get the results of the x-ray. She said the results were not available, but she thought the breast cancer that I had in 2005 had spread into my bones, so she sent me to Sarnia for a bone scan. During the bone scan, I was coughing up blood, so staff there told me to go straight to the emergency department. I went back to Petrolia Hospital again, and they still did not have results of my earlier chest x-ray. So the ER nurse sent me to my family doctor to see if she had received them. When my family doctor was informed by her receptionist that I had returned to her office, I saw her call the ER nurse and angrily tell that nurse that she should not have sent me to her office. Then I was called into an examination room where my family doctor said, "You have pneumonia, go home, take Tylenol, and don't go back to the ER again." I went home on that Thursday. I missed my niece's wedding on Saturday. My sons were looking pretty frightened when they looked in on me on Sunday. I was still in bed, in the dark. I could not eat. I was coughing blood. The whites of my eyes were completely blood red. My nose was running. I ached all over. I had no voice, so I was writing notes. That is when my husband insisted that he take me to the emergency department in Strathroy Hospital. I told him my family doctor would be angry, and he said, "She's probably having a nice long weekend with her family, and look at you." He took me to Strathroy Hospital, where I was put on IV all day because I was so dehydrated. The ER doctor told me to come back the next day for more of the same. On Monday, a young doctor named Matthew, on duty in the ER that day, admitted me to the Strathroy Hospital because he said he had been consulting with other doctors and they didn't know what was wrong and wanted to do more tests. I remained in isolation in Strathroy Hospital until the following Thursday, going through all kinds of tests, even being treated for H1N1. The nurses wore large plastic shields over their faces and extra protective clothing if they came into my room. One very special nurse, Kelby McNally, visited me often during her breaks and after her long shifts. She made me laugh during some tough times. On Thursday, Dr. Gomes came into my hospital room and said he had tried every test he could think of and didn't know what was wrong. He had been working with university hospital staff and had decided he would send me there. Next, 2 ambulance attendants put me on a stretcher and took me to London. I remember them saying to the nurses at University Hospital, "She's all yours, ladies." The next thing I heard was a nurse saying, "You're awake. I'm going to call your husband and tell him we have a surprise for him." It was Monday morning. They had put me in a coma for 4 days. When my husband came to visit, I said, "Look at that poor man across the hall. He has so many machines attached to him." My husband said, "You have more." I looked behind me, and there were so many lights and screens. There were 9 different tubes attached to me. Later, I learned that they had taken a biopsy of my lung and diagnosed me with granulomatosis with polyangiitis. Everybody now. Granulomatosis with polyangiitis. This is a form of vasculitis that inflames blood vessels in many organs. Damage to the lungs and kidneys can be fatal. It requires long-term immunosuppression. Everybody try that too. It strikes 1 in about 30,000. It had invaded my respiratory system. Each time my husband came to visit me in ICU, he had to gown up completely, then wait in a separate visitor's room until someone told him it was all right to come in. He stayed less than 5 minutes each visit. He was afraid to touch me while I was in the coma because the nurses told him they had a hard time keeping me settled. He was afraid he would wake me up. One night, my husband came home from visiting me, and there was a message from my family doctor saying I should call her office. He returned the call and said that I couldn't come to the phone right now because I was in a coma. The receptionist asked that I call her office when I get back. Funny, huh? Keep in mind that my family doctor was receiving complete reports of everything that was happening to me at the time. 4.5 years later, I have not heard anything further from her. I did see her once in a hospital parking lot since all of this happened, and when I said good morning, she just kept on walking past me. In ICU, chest x-rays were taken daily to see if my lungs were clearing the blood. My right arm was swollen to twice its size. I had to use my left hand in its place. Thanks to my sister, I could do that. My nostrils were crusted with painful scabs. The scars remain today. Many medical professionals and students came in to ask questions and observe. The first time a physiotherapist tried to get me to stand, I collapsed back onto the bed. She came back the next day and continued to work with me while I learned to stand and tried to walk again. Nurses worked hard to get me up and sitting in a chair when they knew my husband was coming for a visit. They said I would look better sitting up. I knew if I looked better, he would not worry so much. A couple of steps from the bed to the chair were exhausting. Even sitting up wore me out. My first few steps down the hall, I fainted and collapsed on the floor before the physiotherapist could catch me. There were no injuries, but we took it a little slower after that. I remained in intensive care for 9 days, and then they sent me by ambulance back to Strathroy Hospital to continue to recover and learn to walk again. Once, when I was practicing walking with a walker in the hallway at the Strathroy Hospital, I happened to see Matthew, the young doctor who had first admitted me when all of this began. I thanked him and told him I had been diagnosed with vasculitis. He said he had had a friend who had died in his 20s with vasculitis. He was glad he had made me stay in the hospital until they found answers. Me too. While in Strathroy, I asked about a recommendation for a new family doctor. Dr. Omer Chaudhry was suggested. As it happens, Dr. Chaudhry was a student of Dr. Faisal Rahman, who currently oversees my treatment. We are getting along just fine. Dr. Chaudhry is quick to consult with Dr. Rahman if I have anything going wrong, and they work together very quickly to make it right. I came home from the hospital on September 25th, 2009. Soon after I came home, I was doing laps with my walker around our kitchen table when I began to feel more exhausted and short of breath. I called Dr. Rahman because I seemed to be losing strength, and he saw me right away. He said I had pneumonia and gave me antibiotics, not Tylenol. I felt better the next day. The following Monday, I saw Dr. Rahman again to start the IV therapy. I was to have 6 monthly treatments of cyclophosphamide. I also took an assortment of daily drugs, including steroids, antibiotics, calcium, and vitamin D. Dr. Rahman also sent me for further lung tests. The technician there was able to show me the before and after pictures of my lungs. The first x-ray that was taken showed what looked like white fog where my lungs should be. She said that was blood. It was unusual, so that may be why the staff at Petrolia Hospital could not read it. The current x-ray that she showed me was mostly clear and normal looking. A few days after I arrived home from the hospital, we were surprised when we received a letter stating that we should be keeping record of the 3 units of plasma and 1 unit of blood that I had received during the induced coma. We had not known about this part of my treatment. I was glad to be able to give up the walker by the end of October. I stayed home alone, away from people, so that I would not catch other illnesses while my immune system was compromised. It was very lonely. I wore a Connect Care bracelet so that my husband could go to work and worry less about me. My voice was very weak, and it was usually gone altogether by supper time, if I talked on the phone during the day. I communicated with paper and pen when my husband came home from work each night. Thankfully, I managed to get my voice back by Christmas. On January 6, 2010, I had a hard fall at home and hit my head. Because I seemed disoriented, my husband called the ambulance to take me to Strathroy Hospital again. The x-rays showed what looked like 7 breaks in my ribs, and it was decided that cancer had invaded my bones. I was told to notify my family and get my papers in order. An appointment was made for me at the cancer clinic. After 12 days of thinking this, I emailed Dr. Rahman to see if I could skip my last IV therapy with him, since I was probably going to have to go through other chemotherapy treatments for the bone cancer. Within minutes, he was calling my house saying he wasn't convinced. He was sure it was scar tissue from the vasculitis. He said that I should still see the doctors at the cancer clinic. Thankfully, they didn't find any signs of cancer. What a relief for my husband and me. We were glad we hadn't worried any of the rest of our family with this cancer scare. That was probably the toughest 12 days for me through all of this. So on with what I thought would be the last IV, sorry, that's Roman numerals, the last IV treatment, and then follow with daily azathioprine pills for 2 years. I was gradually weaned from the chemotherapy by February 2012. But wait, there's more. By the end of March, I was starting to have aches all over and no energy. My joints stiffened up, so I had physiotherapy to move easier. My eyes turned red, so a specialist gave me steroid eye drops to clear them. I was losing weight. I was so cold in the office where I worked that I was wearing long underwear under my clothes. At the end of April 2012, I had a checkup scheduled with Dr. Chaudhry. He sent me for blood work right away. Before those results were back, I went for my regular checkup with Dr. Rahman. My creatinine was 520. It had been 85 the previous visit a month earlier. I remember Dr. Rahman hung his head. He said my numbers were so good at my last appointment, and he was so sorry that he would have to admit me to hospital immediately. I said, "Don't worry, Just get me standing for my son's wedding in July. This was the first time that I had thought of vasculitis recurring. I was out of remission. I had not thought of vasculitis as this kind of a disease. I hadn't taken it seriously enough, and this time it had attacked my kidneys. Dr. Rahman brought his class in to watch while he did the biopsy on my kidneys. Each student was given the opportunity to try to find my kidneys with ultrasound. Those young people not only learned something about vasculitis that day, they also saw a demonstration of Dr. Rahman's generous gift of sharing all that he knows. Then Dr. Shah was so quick putting a port in my neck for the 10 rounds of plasmapheresis that I would have to have. That is a process where all of my blood is taken out of my body, the plasma removed, and 6 bottles of donated plasma put back into me. And I thank all of those people that donate. Thank you. On Sunday night, as I was having supper in my hospital room, in walked Dr. Rahman in his jeans and sweatshirt to see how I was doing. I told him he should be home having dinner with his family, and that is just the kind of doctor he is. I feel like I'm his only patient, right? No other patients here? Perfect. Heavy steroids and 4 treatments of rituximab chemotherapy at $5,000 each got me up and out of there in 8 days. The 2 rituximab treatments that I had while I was a patient in the hospital would be paid by the hospital. We had to pay up before I could receive the next 2 treatments as an outpatient. Pharmacy staff at UH helped my husband to apply to the Trillium Fund for partial reimbursement of the last 2 treatments. It was 6 months before we received that check. I had 10 treatments of plasmapheresis at Victoria Hospital as an outpatient. I followed up with 6 rounds of monthly cyclophosphamide chemotherapy. My sister Dawn made the best apple crisp in the world and brought it to me in the hospital. My friend Bev brought quilting magazines when she visited. That was definitely a big part of my recovery. This time I was back to work 6 weeks after I was admitted to hospital, and it was a great joy for my family to have King Faisal and his wife come to our son's wedding in July, and I was even strong enough to dance at the wedding. I had a brief recurrence during treatments in September 2012, and once again, the quick response of Dr. Rahman got me back on track again. He prescribed more steroids, more puffy cheeks. Then I got December 26th, let's go there. December 26th, 2012, I was not feeling well with a blood pressure of 78/56. I emailed Dr. Rahman and he called our house immediately to adjust my meds. I felt better right away. Then I got phlebitis in my arm from the weekly blood tests that I had to do. Dr. Chaudhry and Dr. Rahman worked together and fixed that too. Now I continue to have regular monthly appointments with Dr. Rahman as he keeps a close eye on blood work and gives me the best care that I could ever hope for. Thank you. I don't think I ever took this as seriously as I probably should have. I just kept praying and thinking, okay, what's next? What else do I have to do to get better? I never thought of it in terms of in remission or out of remission. I never thought of this as the end. I always think there are so many other people so much worse off than me. When it attacked my kidneys, I still didn't consider it as a real threat. I had complete faith that Dr. Rahman would do what it took to help me recover. Now I work 3 days a week at a job I love with Brian, preparing children's programs for Lambton County Libraries. My supervisor has been very understanding with adjusting my schedule for appointments and when I don't feel well. Her father died of vasculitis. Most days I come home from work and collapse from exhaustion about 5 o'clock and can't go any further. Exhaustion hits me like a wall and I'm done for the day. And this is way past my bedtime. There are days when I don't go out at all because I need to rest and recharge myself. I miss big things that I really want to attend, like weddings and family Christmas, because I don't have the energy. I have to pace myself. I avoid going out where I know someone might have something as common as a cold. I jump when I hear a cough or a sneeze. People can't come to our house if they're sick. I cannot plan very far ahead because I don't know how I will feel from day to day. However, I have made plans to go with my Dragon Boat team, the Breast Buddies, to the International Breast Cancer Survivors Dragon Boat Festival in Sarasota, Florida in October. It is very healing to be with my teammates, such beautiful women inside and out. When I get to spend time with my family, it makes my heart sing. Vasculitis has certainly put things into perspective as to what really matters and what doesn't. By the grace of God and the hard work, brilliance, and wonderful care of Dr. Rahman and the staff at all of the hospitals, I'm still here to tell this story and maybe help someone else get diagnosed in time. There is no cure yet. It is an autoimmune disease, and it seems to like coming back on me, even during treatments. Since it attacked my kidneys, Dr. Rahman has said that I will have to take chemotherapy for the rest of my life. I will also have to take steroids, antibiotics, Ramipril for the rest of my life. This is probably where I should say my oldest son said that if I keep taking the steroids, I'll soon enough look like Madonna. So far, not enough. Because my kidneys have been damaged, they are unable to process potassium as they should. I have had to adjust my diet to lower potassium. No potatoes, no nuts, no whole grains, no pumpkin, no bananas, no citrus, no chocolate. Too much potassium could compromise my muscles, and I really need my heart muscle. This is a small sacrifice. I don't look at it as giving up things. Whatever it takes, I will do it to have more time with my family. Thank you again for this opportunity to create vasculitis awareness and show appreciation for my family, friends, and all the wonderful people working at our local hospitals. Thank you.